Hello and welcome back. In this video we're going to talk about trauma and how trauma can cause dissociative symptoms, and that in turn can cause multiple personality disorders and one of the main symptoms of borderline personality disorder. We're going to talk about what is normal and what is not, and treatment options for these conditions. My name is Dr. Ruben Gagarin. I'm your favorite family psychiatrist. Let's begin. Not long ago, I had a patient who was admitted to our unit for suicidal thoughts. But when I met him for the first time, his main question was, do I have borderline personality disorder, or BPD, or dissociative identity disorder, DID, or in old terminology, we used to call it multiple personality disorders. See, having spent a night on our unit, he was already calm enough and ready to go. He felt safe, and the main question he had is, what is wrong with me? Why did he think that he had borderline personality disorder? Well, he had moods going up and down, he had rocky relationships, he was terrified of abandonment, so he looked it up and did some research, so he thought that he might have borderline personality disorder. But then one of his friends noticed that sometimes he speaks in different tone, using different voice, has different demeanor, so they thought, well, what if I have dissociative identity disorder? And here we were talking about it. So what he told me was that growing up was kind of traumatic to him. And some of these traumatic experiences, most people would not judge as traumatic. So for example, he felt that his sister was favored over him. He had some history of bullying. Nothing that would threaten his life or integrity, but it still was very traumatic to him. So in any case, he told me that he started thinking about this dissociative identity disorder, and then he realized that he actually has different sort of identity states, and each state has a predominant emotion, and these states seem to be connected to very particular traumatic experiences from the past. He told me that he's mostly aware of these personalities and he switches from one to another, but he felt as if he has no control when the switch happens. Jeff also reported a lot of dissociative symptoms. So frequently he had lapses of time, he wouldn't remember how he walked from school to home, or he may have an argument with someone and he didn't quite remember what happened. Sometimes he felt empty inside, and other times he felt as if he's not real, living almost like in a dream, or the world is not real. So this was very disturbing to him. Before we start talking about dissociative symptoms, let's try to understand what is normal is, what is opposite to dissociation, and surprise, surprise, it's called association. Another word that we can use is integration, when we associate and integrate something together. What is that something that we associate? Let me use myself as an example of normal, despite the fact that I'm a psychiatrist. So when I was younger, much younger, in grade 4, we started learning English. That was the very first foreign language that was introduced to us, well, the only language. So, and at that point, I had been a well-established, good student in math, history, and other subjects. So I felt very confident that I can take on another subject. But to my surprise, I couldn't. I tried to learn vocabulary and I don't think I had enough memory for it. I couldn't understand the grammar. I couldn't get my head around it. So pretty quickly I gave up. I told myself that I have no language gifts, so therefore I'm incapable of learning that language, and all I can do is just try my best. So I did. I always got C's, maybe B's, so of course I passed, but I didn't really do very well. So let's just break this example down. So what happens is in normal association or integration, it all starts with sensation. So in my case, that was a negative feedback. It was negative sensation associated with English, or positive sensations or praise that I received in other subjects. So when it repeated a few times, my brain sort of memorized all of this negative feedback that I was getting from my English teacher, and it concluded from the pattern of negative feedbacks that I'm incapable. Well, later, of course, I learned that I can learn English, and as a matter of fact, I'm kind of better than average, so I don't have a learning disability of some sort. But at that point, it was integrated in my identity so much so that even when I needed to prepare for my interviews to immigrate to Canada, I actually didn't even put enough effort because I believed that I am incapable, therefore there is no point of putting any effort. So, formally speaking, it starts with sensation. Then the next step is our brain, based on our previous experiences and priorities, like internal priorities, it sort of filters out extra information and focuses on something that brain decides is important. For example, pain. If I burn myself, then brain experiences pain, so it filters out everything else, like whatever other people are saying, or the noises around me, or the lights, etc. So it focuses just on the pain. So it starts with sensation, then there goes filtering out extra stimulation, then it goes into cognitive appraisal. So we use our prefrontal cortex and frontal cortex to analyze what does this experience mean and how can we respond to it. It makes decision what we should do next, and then if it repeats a few times, it incorporates that in our identity. There are huge implications of what I just said. What that means is that every single second, we incorporate our experiences in our personality. So our personality constantly changing. So right now, I'm making these videos, so part of my identity now is a YouTuber, and I didn't used to have that identity. So what happens with trauma and dissociation? Now we start understanding how our day-to-day experiences get incorporated in our personality. Now, what happens if there is a trauma, if there is significant pain? Well, let me use this example of a car crash. If a person ends up in a very bad car accident, they sometimes describe as if their soul gets detached from their body. It floats over the scene. It sees the cars flipped over and the police officers and people crying and suffering. They even can see their unconscious body kind of laying in the car, maybe all like covered in blood. And what it does not see or feel is the pain. And that is one of the main reasons why we have dissociation. It helps us to dissociate our sensations that is totally normal from incorporating it in our personalities, or like evaluating it, appraising it as our own experiences. And that really helps, because I would personally rather fly over the scene and see everybody from outside than laying in that car and suffering from a lot of pain. What's supposed to happen after is that we turn on our cognitive abilities, we understand this experience, we maybe talk about it, we think a lot, we go through memory step by step what happened before the car crash, and eventually, little step by little step by little step, we incorporate it in our personality and our identity. So then we become a person with this traumatic experience, but the traumatic experience doesn't affect us emotionally every single day. But sometimes when we think about it, it can still raise kind of negative feelings. However, what if the traumatic experience is so traumatic that it is impossible to incorporate? It's just incomprehensible to incorporate it in our personality. Well, what our mind does, it splits it. It basically takes that traumatic experiences and assigns it to a different person. So, and in the same brain, a person may develop different personalities. So one kind of main personality with the childhood memories, etc., etc., and another personality that is defined by a particular traumatic experience. So in a way, this is what Jeff is experiencing. He tells me that he has this main personality of Jeff, and he has a few other personalities that have different emotional affect, but most importantly, they all draw their identity from a particular traumatic event. Fortunately for Jeff, he retains memory of each personality and trauma that it is associated with, so in the future he can use this to help himself in therapy. Now let's touch upon borderline personality disorder. Let me start what is personality disorder means. Well, it means that the sense of a person is unstable. It is not coherent from one point to the next, so that's why we call it a personality disorder. Many symptoms of borderline personality disorder are driven by dissociation. Even self-harm, it's a ticket out of that dissociative state that brings the person to reality. And other symptoms may include feeling empty, feeling disconnected from reality, feeling as if they're living in a dream, etc. So why Jeff thought that he may have either borderline personality disorder or dissociative identity disorder is that because from moment to moment, he couldn't really tell who he is. In his particular case, he has borderline personality disorder, or BPD, because he retains control and recollections of his experiences and different personalities. But he is at risk of developing DID because if he continues to channel his negative emotions in particular personalities, at some point he may lose that control, and when he becomes consumed by dissociation, he may lose that control over his own personality. I see BPD and DID more part of the same spectrum rather than two separate conditions. And how do we help people with dissociation? This is very tricky. I wish I had a medication that I can prescribe and a person takes it every day and their dissociations go away. Is it possible? It is not possible. I don't think that there is going to be ever research that shows that, because to block the dissociation with the medication or any kind of procedure would really mean to rob a person from a very important way of dealing with life pain, and we all have pain. So what do we do? Often we still have to start with medications. Why? Well, because the main treatment for dissociation is psychotherapy, is actually integrating and disassociating the past traumatic experiences with the main personality. But if I constantly dissociate and it gets worse when I recollect the trauma, how am I supposed to incorporate all of this together? So we have to start with medicine. So taking Jeff, he has moods up and down, he has suicidal thoughts, so it is very hard for Jeff to start talking about his trauma and start incorporating these experiences into his personality. So he should start with antidepressant to lower his depression that hopefully would give him enough strength to start talking about trauma without losing control over his emotions. So the main treatment for dissociation is trauma-focused therapy. We usually don't start with talking about trauma. We start with developing trusting relationship. We start with learning coping skills as alternative to dissociation as a way of dealing with traumatic memories. And when that is in place, then we can start talking about trauma. Why is it important? Well, rewind back and see how association and integration is so important in processing our life experiences. So at the end of the trauma-focused therapy, a patient feels fine. So they don't dissociate, they don't have flashbacks, by the way, probably also part of dissociation, and they live their life normally, although every time they have traumatic memory, of course, they're going to feel sad or angry and other negative emotions. And when that integration happens, a person may let go of the medication and continue living their lives, but much happier. So this is it for today. We're going to talk about trauma and personality disorders. I'm sure we'll come back to dissociation in the future. So please tune in, leave a comment, subscribe to my channel if you find this interesting. Thank you very much. Bye-bye.